Hello! Welcome to Healthcare Triage Live. We have a new thing where we try to make me as angry and upset as possible seconds before we go live. Maybe I can bring the energy right here. So let's power on. Anyway, usual stuff. You see the links on the screen, ways you can support the show, patreon.com, healthcare HCT merch, hdmerch.com. You should even for nothing check out the Facebook page, facebook.com/healthcare triage. Check out the Reddit site if you like. It's all good. It's all healthcare triage. Let's begin. Anton Brunberg, is there any research are there any basically is coconut oil work? I don't know of any good research that shows that coconut oil has any solid health benefits. I'm sure that as part of fat and necessary fats, maybe you could find that, but I don't know of any good randomized controlled trials or anything else which would point and say coconut oil is the way to go. That's what we should be having. So I would not be recommending it above anything else. You've seen my food recommendations. You know where I stand. If not, go watch that video. Very popular. There's a nice poster even of the recommendations on the Facebook site. And you could download it for free because that's the kind of nice people we are. Mr. Lumpkins asks, are there any high quality, you guys got to get your grammar down, man. Is there any high quality research on the efficacy of ketogenic diets in adults to aid in seizure control? Interesting question. Yes, the answer to that is yes. I think even more so with children than with adults. But of course, children become adults, so that will work. There are certain types of epilepsy that are associated with certain genetic or metabolic malformation problems like GLUT1 mechanism issues or kids with pyruvate dehydrogenase deficiency who therefore have certain issues of metabolism where switching to a ketogenic diet gives the brain other sources of nutrition which actually reduces the risk of seizures and helps keep things under control. Dravet syndrome is another one. Now you're really going into my memory banks, which is a severe form of epilepsy in infancy. That also, I believe, will be better controlled with a ketogenic diet. Because of this, sometimes we expand it and then we try ketogenic diets for lots of things, and then you might be getting into placebo effect or whether it works. But there's absolutely some evidence, I believe, that there are specific instances or types of epilepsy where a ketogenic diet is definitely recommended, if not warranted. And if you get good control, even as an adult, even if you don't have one of those syndromes, by having a change in your diet, I'm not going to fight you. You should do whatever works for you. I try never to judge other people's diets. But, I would talk to your doctor about whether you have to do it because it's not easy and some people don't like it. But definitely if this is something that's about you personally, you should be talking to your doctor, your neurologist, or whoever you see to help you care for your epilepsy to see if a ketogenic diet is right for you. Now I sound like a drug ad. That was terrible. Nanosphere V. Healthcare Triage. What do you think of this? Ketamines use in drug-resistant depression. Stan sent me this link right before we did the show, and I feel like we covered this in a Healthcare Triage news or something. I know we definitely covered the ones with shrooms. Was shrooms or was it LSD? It was shrooms. Yeah, it was shrooms to cure mental health issues. And there's a lot of growing evidence that a lot of this stuff works. So we have to do an episode someday on antidepressants. But in recent years there have been a number of controversial but reasonably well done articles which show that for many people, solid antidepressants do no better than placebo alone, and that a lot of the effects seen from antidepressant use may be more placebo effect than actual effect. Because of this, there's been a growing dissatisfaction with many of the antidepressants that are out there, and a growing push to try new and novel treatments for especially major depression, intractable depression, and other mental health issues. And there's a growing shift and push to try to use things like ketamine. I think in the UK there's been a lot of work, but they do trials where under very controlled conditions, mind you. This isn't like we're doing it at parties. In very controlled conditions, they're trying to use ketamine to see if they can sort of break the cycle or the way that intractable depression is working with some reasonable results. Now, granted, this is all preliminary, and they need to do more work. And we're talking about the kind of depression where you can barely get yourself out of bed, and do anything And so it's not like, oh, I have mild depression or I have some depressive symptoms. It's for really intractable major depression. But there's work going on at the NIH now and at other places to try to see if that works. So what do I think of it? I think that research that's trying to advance our understanding about health and do a better job is awesome. So the research I support, saying you should go to your doctor and demand this, I don't know if there's an evidence base for that yet. Christina Lai, is there any research to show if the graphic anti-smoking ads being effective? If so, could the same principle be applied to other unhealthy habits such as tanning? So we don't know. I think people think that there is. So in Indiana a couple years ago, many years ago, in fact, they were running these ads on child safety, and they were unbelievably horrific. Like, there's a birthday party going on, and like everyone's happy and smiling, and it's home video. Then all of a sudden they realize, where's this kid? And they find him face down in the pool, and he's dead. And the video is like, you should make sure that you watch kids around pool. There's another one where newborn mom is sleeping next to her child on a sofa, and the dad creeps up with the home video, and he's like, oh, look, mommy's sleeping with baby. And you're like, you get tears in your eyes because it's so nice. And then all of a sudden the mom wakes up and she smiles and she's like, oh, you're taking video. Oh, this is so awesome. And then they realize the baby's not really responsive because the mom might have rolled over onto him and he's smothered and now he can't breathe. And they all start freaking out and call 911. And it's horrifying. And I actually argued that I was horrified by these, and I didn't like them because my kids might see them on TV, and to be honest, they made me really upset. And then I worked with experts in the field at my work who argued, if we save one child's life, isn't that worth it? And I, of course, being the sort of measure benefits and harms guy that I am, was like, well, are we sure that it's saving a life? And I actually do think we could weigh, the incremental life against the trauma and everything else. I don't know. I don't know the answer. I think it's the same as your question. Is this worth it? So part of what you'd want to measure is like, how much harm are we actually doing? Those graphic anti-smoking ads, if I remember correctly, are on the cigarettes. So it's not as if I think we're trying to hit the public as much as we're trying to hit smokers. So it's a slightly different question. And then the second thing is, how good is the evidence that this is a real problem? Smothering in your sleep, lots of people co-sleep, lots of cultures promote co-sleep. It reduces actually the risk of SIDS and other things. So we can get into a robust argument about whether the lives lost here are different than the lives gained here. So I don't know. Now, drowning in a pool is so bad and so unequivocally bad and happens that maybe that's a different thing. Smoking is horrifically bad, obviously. Terrible. So the incremental possible damage there is huge. So we'd have to just at that point say, like, what's the harm to the general public for seeing this? And does it actually work? I don't know. I bet there's got to be literature on that. Now, can we apply it to tanning? You know how I feel about tanning, so my bias there. I think it's crazy. But so I know I'm biased, but why not? I would imagine we could do this, but how would we do it? Would we put it on the stores? Like, you couldn't get the stores themselves to advertise, so it would probably have to be a widespread public campaign. And at that point, it's like, how pissed off are we going to make people who would never tan anyway and who recognize it? Because I don't want to see. I don't. So these are great. That's a great question, and I can imagine how we could set up the trial and the cost benefit analysis, and we could really try to figure it out. Unfortunately, I don't think the data are there. But of course, you can make this argument to any unhealthy public thing. We could do it with sugar and obesity and everything else. The problem is people in general don't want to be, really pushed hard. They don't want to see incredibly unpleasant things. A lot of times they know what they're doing is wrong and they can't stop smoking, for instance. It's like, if you don't know smoking is bad for you at this point, you're not paying attention. This is not a lack of information. It's just, how much benefit are we doing and what's going to work the best. Is graphic scare tactics work the best? I don't know, but that's a good research question. Sarah Ezit asks, hi, Dr. Carroll. Like many people, I'm watching events in Flint, Michigan with horror. There's a lot of talk about how the lead exposure is going to affect the kids. I wonder if you could explain some of the science behind this and what medical and other help those kids might benefit from. Love the show, Sarah. Well, that's really nice. Thank you. I'm only going to defer this because it's like, we're going to do this in much more detail than I could do it on Healthcare Triage News in the near future. So on Monday, you should go to the Upshot at the New York Times, where I have written a column on this exact topic. talking about the educational damage that's likely going to happen to kids in Flint, the societal and behavioral damage that's likely going to have, let alone, all of this. Lead is a horror. Lead is been linked to huge long-term deficits. It's likely that adults like me suffered significant, and again, it's like what you're all taking a grain of salt, but significant IQ damage of many points because we grew up in an era of leaded gasoline and lead paint everywhere and everything else. Lead screws with you. There's a lot of people. Kevin Drum has written a fantastic article in the Mother Jones a couple years ago where he basically makes a convincing argument that the crime waves of the 70s and 80s were likely due to lead. And that as we eliminated lead from environment, that's the reason crime has dropped so dramatically in the United States. One of my Amherst colleagues, in fact, she was a chemistry major with me. Her name is Jessica Walpaugh. Now she's Jessica Walpaugh-Reyes. She is a professor of economics at Amherst, which I'm very jealous of. And I actually got to go as a visiting professor there a couple years ago. She's one of the world's experts on sort of the lead and behavioral effects on children and has done a lot of the work that shows lead's effects on education, lead's effects on behavior, lead's effects on crime, all this stuff. So we're going to cover all of it in a healthcare triage episode, probably, let's say, in about a month, because it just takes us that long to tape and get it out. But in the meantime, you should go read New York Times, The Upshot, on Monday. Maybe they'll put it in the real paper. I don't know. If they do, I'll let you know. Tweet me, and then I'll personally let you know when it goes up. But there's a lot of research out there. We're going to get into it in much more depth and go through it in an upcoming episode of the regular show. Next question, Ben Fuchs, who wants to ask about caffeine. I'm looking at my watch, see what time it is. We got plenty of time. Caffeine for kids. You mentioned that you give your kids only caffeine-free soda because caffeine works. What about situations where that might be the target? My daughter drinks 1 cup of caffeinated tea every morning. Think very weak black tea, only with more sugar because it, quote, makes waking up so much easier. Is that much harmful? Should I consider getting one with no caffeine? What's the data on the topic? So some of this is going to be like, well, let me say, how old's your daughter first? If she's an adolescent, a teenager, I'd be like, whatever. It's caffeine. She's going to be fine. The reason I don't let my kids have caffeinated soda is because most of the time they're getting it, it's like at dinner time or night, and I don't want to interfere with their going to sleep. And that's probably overkill, but I do it anyway because that's just habit from my kids were really little. But if they're out and they might have a soda at lunch, go to town. Caffeine soda, I don't care. Even if it's like a dinner and it's a weekend and I don't care about them going to sleep so much, I don't care about the caffeinated soda. It's just if it's the, infrequent times that they're allowed to have soda, in a later dinner during the week when I know my kids go to bed pretty early. If I want them to go to bed early, then they're getting caffeine-free soda. But that's a judgment. That's just because that's my bed, that's the kid's bedtime and everything else. Caffeine is not necessarily harmful for kids. It's the same kind of a consideration that I would give adults. Some people believe it has more of an effect in their behavior, but that may be just a weight-based thing that, 2 cups of coffee, one given to a small child, one given to an adult, are 2 very different doses of caffeine, so maybe you're just getting more. But I don't know there's not that much harm. Having said that, I don't go out and tell my patients and people like, go drink caffeine. But if your daughter likes a cup of tea in the morning, fine. I would limit the sugar. Added sugar is a bad thing. That of course I get into trouble because I have a sweet and low in here, not sugar, because I'd rather not have the calories of the added sugar. My kids have sort of learned the same thing because that's what we do in our house. We're avoiding the added sugar. I also drink coffee sometimes without sweetener. It depends who's making the coffee and how good it is. I put sweet and low in this. But I don't think that necessarily your daughter drinking a cup of caffeinated tea in the morning is fine. Now, if she's drinking it because you think it makes life easier, that I might have a problem with. If she's drinking it and she says that makes her life easier and she likes it, so be it. Caffeine does not stunt their growth. Coffee does not stunt their growth. Tea does not stunt their growth. Tea is not harmful. I don't think a limited amount of caffeine is going to be harmful. But you're now getting Aaron Carroll's personal viewpoint. There are not good randomized controlled trials of this. But again, I'd be interested in knowing how old your daughter is. That might make a slight bit of difference in my answer. Christina Lai, is there any research on leaky gut syndrome, or is it all made up? Made up is pejorative. And so I'm not going to say it's all made up. But it's an unrecognized medical condition. It is something that is more often used by non-MDs, which of course gets into the whole alternative versus traditional, but it's like there's no like sort of set diagnostic criteria. There is no set treatment. There's no set way of knowing this is leaky gut syndrome and that is not. It is what we used to often call like a wastebasket diagnosis. When you can't find any other thing to call a collection of symptoms, sometimes you say it's that. Some people call, what we might call irritable bowel syndrome or other issues, leaky gut syndrome. If we don't have a good way to define it and we don't have a good way to treat it, then usually I don't like to put a label on it like that. We've done an episode on how labeling something a disease sometimes makes things worse. So I don't know that there's any good research because we can't really define it. So that's probably not as satisfying as you would like, but that's the best I can do. Liz Barino, does blue light from cell phones really hurt sleep? So I've been reading this more and more, and like there are even apps out there now that will like automatically change your computer or your phone. So a lot of this stuff is, lab-based epidemiologic, not I think randomized controlled trial in humans for long-term outcomes. But some people say yes. You know what? This is such a good thing. I'm going to look it up for you. Please, Liz Barino, will you tweet me and remind me? Because I will look into that and decide if it's real or not. And if it does look like it's interesting, maybe we'll do an upcoming episode on it. Because that sort of was fascinating. I'm writing stuff on sleep right now, and I came across some articles on that, and they were arguing that like it interferes with sleep, but they're also arguing that it has longer term neuropsychological effects as well. And I just don't know enough about it. Let's look into it. Amanda Cook, my 2-year-old daughter has been sent home for stuff like eczema and dry skin, and I'm wondering if the school's any rash equals get sent home policy is evidence-based. No! Why would they send your child home for eczema? Oh. Amanda Cook, I'd love to know where you live. We should take on the school system together. I don't like any of these sort of blanket school policies. I think we've even talked on healthcare triage about, they have that like your kid gets pink eye and they send him home from school until the kid's on 24 hours of antibiotics, which one, ignores the fact that probably half of pink eye is caused by viruses and the antibiotics will do diddly squat even after 24 hours. Two, that even if you put eye drops in your eye, what are they in your eye for like 10 seconds? That's not prevention. Three, it ignores the eye. It creates this crazy world where you think the 24 antibiotics renders you non-infectious, which we've definitely done an episode on. Because that's just not true at all. People are infectious before, on, after. There's no idea that you're not infectious anymore, but that's what they do. You come home, you get put on 24 hours antibiotics, you go back. And every time they did that, my wife and I would lose our minds. Probably me more, because I'm more apt to do that. You're asking about eczema and dry skin. So eczema is atopic dermatitis. It's a body's like internal sort of, I don't want to say autoimmune, but it's reacting to itself. It's a creation that's not an external stimuli or you got a rash from an infection. You just get sort of dry, flaky skin that can run from very mild, just some dry skin, all the way up to pretty severe, like needing hospitalization. But it is not infectious. It is not contagious. It has no danger to anyone else whatsoever. And you can't control it in a day. I mean, it takes like weeks sometimes of moisturizer and steroids to get, sort of eczema under control. So the idea that they send you home, there's no rationale for doing that and no quick fix to like get your daughter readmitted. So I don't understand that at all. You can't make the eczema go away in a day. So what do they expect you to do? So yes, now I'm getting heated because this makes no sense whatsoever. But yes, I agree that if your school has an any rash equals get sent home policy, it is not evidence-based and it's probably hurting them educationally for no apparent benefit whatsoever. Diana, the inorganic vegan, asks, lack of agricultural research funding, how big of a public health issue? Well, big. But I mean, I don't think that there's no agricultural research funding. The problem is that it's not put into what I'd like it to be put. I'd like to see some serious, hardcore nutrition research. Like, let's do some real randomized controlled trials. Let's get some real stuff going. We don't do enough of that. You've heard me rant about it. We've done episodes on it and everything else. There's lots of agricultural research funding. It's just mostly into policy and GMOs and, can we build better wheat? Companies spending ton on agricultural research, but it's not on what I would like them to spend research on. It's on other stuff. It's probably not what you would like them to spend research on either. So given that obesity is a monster health issue, given that we still have a woefully lack of understanding of like how all this stuff fits together. Yes, I would like to see that, and I think it's a public health issue. But I wouldn't just say that there's a lack of agricultural research funding. I just wish it was steered in a different direction. The Novice Mind asks, sorry about this, checking the time. What are your thoughts on the new anticoagulants? Rivaroxaban, apixaban, blah, blah, blah. That focus on less monitoring versus the older types like warfarin. Is that an effective strategy to have more resilient drugs? And I go blah, 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 because I'm a general pediatrician and I don't use any of these drugs. However, I know something about them, even if I can't pronounce them. And so, warfarin is it's been around for a long time. It's Coumadin, and it keeps you from coagulating, and therefore if you have some process where you're worried about forming clots in your body, you go on warfarin. Warfarin too much, however, terribly dangerous. Rat poison is warfarin. If you eat too much of it, the rats bleed out and they die. That's what we use often in rat traps to kill them. It's Coumadin, it's warfarin, it's crazy. So we have to monitor you very tightly while we put you on these drugs like warfarin to make sure that we get to the sweet spot where you're not going to clot, but you're also going to clot if you need to so you don't bleed out. And we're pretty good at it at this point. But when people get sick, when the other medications react with the Coumadin, you got to do monitoring to make sure that you get the sweet spot. There are new drugs, though, where we don't have to do that monitoring. We just sort of have a better sense. We give you this drug, off you go. You don't have to get the lab test. You don't have to get everything. It's great. And people like that a lot more. The problem, as many of my friends who practice medicine more clinically, especially in critical care, will tell you, is that it's much easier to reverse Coumadin's effects if you need to. So if somebody comes in and they have too much and they are like bleeding out, we can fix the Coumadin problem. We can give you stuff to make that better. We can't fix some of these new anticoagulants as easy. So as one of my good friends, when I was having lunch with him last week, was complaining he had a patient come in, he's a critical care doc, where clearly she'd been on too much and she was like really too anticoagulated with one of the new ones, and they couldn't fix it acutely. There was no way to do that. And so he was arguing that while lots of people love those new drugs, that's a real problem. And so there's pluses and there's minuses, and you should talk about them with your physician if you're going to be on one of these. Veronica Cherry, Tjioe, I don't know how to pronounce that. How long is a cold contagious for? Well, according to your school, 24 hours unless you're on antibiotics. Well, just kidding. I've been sick for 10 days, and I'll be visiting someone on chemo this weekend. I don't want to get them sick, of course. And now I feel bad for making a joke. Anyway, if you're still sick, I probably would not. Especially if they are immunocompromised and they are worried. You do not want to give a virus, or even a bacteria for that matter. You don't want to give anyone an illness for someone who is neutropenic or on chemo and can't. Because if they get a fever, they have to be admitted to the hospital. Because when people have neutropenia or very low white blood cell counts and they get a fever, we don't know if it's serious or not. Basically, we have to admit them and put them on antibiotics until the cultures are done and until we know if they're not. The thing is, a cold would be contagious. We don't have a set number, but if you've been sick for 10 days, first of all, it's possible you've had more than one cold. You could have gone in and out of infectious with something and then something else. There is no set number. If you're still shedding virus, which is possible, you could get someone else sick. And someone on chemo is almost by definition immunocompromised. And so I absolutely would talk to them and have them talk to their doctor about whether this is okay. And maybe I'm being overprotective and maybe it's just fine. I don't know for sure for you. But I would not just assume or make a guess or rely on the internet or what you read, or even something that you see on YouTube to make this kind of decision. This is an actual medical decision that needs to be made. It needs to have an actual conversation with the healthcare provider, probably the oncologist, to talk about whether this is safe for that patient or not. And so right now, is there any advantage or disadvantage of them going to bed later? So there's a disadvantage. They're going to bed later. Is Amy and I... Last question. Margie Pasman, you said your kids go to bed early. Wow, we're getting questions. I used to joke, we used to put our beds to bed, and after that was that was Aaron time. That was Amy time, and it still is. My kids, and this is going to shock many of you, I have a 14-year-old, a 12-year-old, and a 9.5-year-old, and most school days they are in bed at 8:15 for an 8:30 bedtime. And I swear to you, my 14-year-old is out cold by the second I leave the room, and he's like the last to wake up. And on weekends, we let them go to bed later, and they sleep in. And they need that much sleep. They need it. Now, on gaming night, the boys come with me, as we had last night, and then they stay up till 10:30, 11, and they're fine. And as they gotten older, I've loosened the restrictions on that. But on weeknights, and Sydney even stayed up later, I think with her mother, maybe till like 9. But most nights they go to bed early. They need that much sleep. And I know they need that much sleep because we still have to drag them out of bed in the morning when they wake up. I told them that now they can read in bed or they could do some stuff before they go to bed, but they are in bed at that time, and I swear to you, Jacob, every night, bang, out cold. Pretty early, like 6:40 for the boys and like 7:10 for Sydney. And, on weekends, as I said, they sleep in, and it's not like they can't fall asleep. So that's the advantage. The advantage is that they're getting enough sleep. The advantage is it gives me a little more free time at night to have some time to get some stuff done or, have a free moment to talk to my wife. And so those are advantages. The disadvantages are some families can't hack that. I'm lucky in my job that I can be home for dinner by 6 o'clock almost every night of the week. So it's not a problem to have dinner at 6, with my family, spend some time with them, do whatever work we need to have done, play a game, do whatever, go to bed at 8:15. That works. If I couldn't get home, as many people do, till 8 o'clock, I'd probably make my kids stay up later. It might be the only chance I get to sleep them. So I'm not judging people who keep their kids up later. So the advantage is sometimes is that's the only of going to bed later is sometimes that's the only time you have to spend with your family. That's the time you get. So use it. The disadvantages of the later bedtime is it's harder for your kids to get enough sleep because that time they have to wake up in the morning is fixed. I'm sure they would argue there's advantages and disadvantages too. They want to stay up later. They want to do stuff. They want to play. They want to watch TV, whatever. And there's obviously less time in that the later they stay up. So this is a personal decision that parents make. I just like to say it's possible to go to bed earlier. You can put your kids to bed early. They will go to bed. It's possible to set rules and do that stuff. It's possible even to have exceptions to those things. But every family should make the decision that's best for them, for their children, and everything else. And that should do it for Healthcare Triage. Thank you so much for tuning in live. Monday's episode is on, I can't remember, but it's going to be awesome. Alcohol. You're going to love it. It's all about alcohol and the benefits, harms, blah, blah, blah. This week's Healthcare Triage News, 2 new studies. You should watch that as well. The Zika virus video from Monday is doing decently. You should go watch that. Learn everything you need to know about Zika. Check out the Facebook page. Check us out on patreon.com/healthcaretriage. Anything you can do, $1 a month. Anything you want to do supports us and really shows us that you guys love the show and we really appreciate it. Check out the Reddit site, hctmerch.com. Anything else? Really love all of your support. Thank you very much. We'll see you next week.